What do measles, K2, and dextrose have in common? Well, nothing really. But for this region's EMS update, those are the three things that you need to know. Hi, I'm Dr. Peterson, and thanks for tuning in. 3 years ago, it was the Ebola virus outbreak. Last year, it was the Zika virus. And today, it's measles. Measles? Really? Isn't that just one of those fever and a rash that kids get? Well, no, and here's what you need to know. Measles used to be one of the most common rash-producing childhood illnesses. So common, in fact, that in 1905, pediatricians tried to simplify things and assign a number to each of the viruses. Measles took the #1 spot. First disease, they called it. Over the years, other names emerged, and today we have measles.
Measles is one of the most contagious of all viruses. 90% of people who are exposed and not vaccinated will get it. The virus lives in the nose and throat. It's spread by breathing, coughing, sneezing, or coming in close personal contact. It can hang suspended in the air or on a surface for up to 2 hours, meaning you can catch it by just walking into a room. One person can infect as many as 18 others. The virus incubates for 7 to 14 days. Then the first sign of measles begins: high fever, cough, runny noses, and red and watery eyes. After several days, a rash erupts. Red flat spots appear on the face and then spread downward to the neck, body, arms, leg, and feet. An infected person is contagious from 4 days before to 4 days after the rash breaks out. Ear infections and diarrhea are common complications. More severe cases can lead to pneumonia or encephalitis, a swelling of the brain, which can cause permanent brain damage. 1 or 2 in every 1,000 children with measles will die. But measles is preventable with a vaccine that is 97% effective. Measles vaccination started in 1963 in the US, and the virus was declared eliminated in 2000. That means it no longer originates here. Still, there are about 20 million cases a year worldwide. That means an unvaccinated person can bring it into the country while traveling, which is how a current outbreak may have started at Disneyland. The U.S. has seen 102 cases in at least 14 states in January of this year alone, a rate that has health officials on high alert.
As of today, the outbreak in Minnesota spans 3 counties: Hennepin, Ramsey, and Crow Wing. The majority of the cases are in unvaccinated Somali children, but there's no end in sight, and it will likely get worse before it's over. So why is this important? Well, measles can be a nasty little virus. Most kids do fine, but the complication rate can be a lot higher than with other viruses and can include pneumonia, brain swelling, and even death. So we need to be diligent to make sure we're protecting ourselves as well as our patients. Here's what you should ask next time you are dispatched to a sick child. Is the kid between 1 and 5 years old? Does the kid have a fever, cough, runny nose, or red itchy eyes? Is the child up to date on all of their immunizations? If the answer to all of those questions is yes, then you need to implement airborne precautions. Notice I didn't mention rash. That would be a dead giveaway, but doesn't often appear until several days into the illness. For suspected measles, the current recommendations for airborne precautions include an N95 or PAPR mask for emergency responders and a standard mask for the patient. Try to avoid nebulized procedures unless absolutely necessary, and if you can, maintain a list of anybody who has close contact with the patient. This information should be given to the receiving hospital so that follow-up can be arranged in case the patient actually does have measles. After the call, you need to make sure you do a good job of cleaning your rig. Measles can live in the air for up to 2 hours, so the most important part of decon is ventilation. Open it up and air it out. Beyond that, refer to your agency's protocols for standard cleaning. No special wipes or disinfectants are necessary. So what's up with D50? Well, besides being a magical serum that can bring someone back from the brink of death, it's also subject to the whims of a capitalist economy. The D50 production facility has been purchased by another company and had to shut down temporarily so they could switch over some equipment. Kind of leaves us hanging because we go through a lot of D50 around here. This may not affect you depending on your stock, but Regions EMS will be stocking bags of D10 just in case. We actually looked at switching to D10 recently with our last guideline update, and a number of agencies across the country have already made the switch. If we should happen to break open our D10 stockpile, here's what you need to know. D10 comes in 500cc bags. Not quite as convenient as the D50 preloads, but you'll have to deal with it. Each bag of D10 contains 50 grams of dextrose. That's twice as much as an amp of D50. So let's keep it simple. You hook up the bag and you infuse 100 milliliters of D10, repeat to effect. That's 10 grams of dextrose per dose, titrated to an adequate blood sugar. D10 has several advantages over D50. It causes fewer swings in the patient's blood sugar levels, won't damage the body tissues if your IV or IO fails, and doesn't have to be diluted to give to pediatric patients. I'd be curious to hear what your thoughts would be on switching to D10 in the future. Go to facebook.com/regionsems and check out our D10 poll to give your feedback. The last thing you need to know for this update is about the current drugs of abuse. Several of you have asked about carfentanil, and although we haven't seen any confirmed overdoses in our area, it is in the Twin Cities. Just remember that the treatment for an opioid overdose is adequate airway management and ventilation. Narcan is just a tool to help you solve a breathing problem. Carfentanil may require more Narcan than you have available in your trucks, so don't delay airway management while you're waiting for the Narcan to work. The other drug that we're seeing a lot of recently is K2, or synthetic marijuana. This drug causes a lot of bizarre side effects, such as unconsciousness, seizures, extreme agitation, and even a zombie-like trance state. You can search the YouTube for K2 videos to see what I'm talking about. Just be prepared that these patients are at a high risk for excited delirium, so they may need lots of fluids and benzos before you get to the hospital. That's all for this update. On behalf of Regions EMS, be smart, be safe, and be professional. Thanks for watching.